This is the Medical Inventor Podcast, where you can learn about new technologies and research in healthcare that will impact human lives.
Okay.
Yay.
By the way, we're speaking on English, you know.
Okay, I didn't know that.
Okay. I hope that won't be a problem.
You'll figure something out.
Yeah, so I don't have my synopsis here, but do you have internet? On your phone, maybe?
Probably.
Okay.
You want the text?
Good job.
Yeah.
Okay. So, this is the third episode, and today we're talking about a big buzzword, a big popular technology on healthcare conferences, digital health conferences, and that's blockchain. And we're gonna talk about what can it be used for, is it useful, and where's the hype, where's the buzz, and trying to figure out what are the exact problems, the exact use cases, and things like that. So, on my right we have Mr. Voras.
Hello.
He's the greatest blockchain developer. He's been developing for 30 years already.
Not on blockchain.
Not on blockchain, but he's been building blockchains in C++ from the ground up.
Yeah. The last couple of years I've been working on some blockchain projects, and basically I was working for like early exchanges and early brokerages since 2014. So I had experiences in mostly Bitcoin, Ethereum, and other popular blockchains. Mostly public ones also. So yeah, that's my bias kind of.
Okay, so he's also the author of the book Bitcoin.
Skeptic's Guide to Blockchain, Bitcoin, and Cryptocurrencies, or
So
something like
is
that.
it only in Croatian? You also have an English version, or
It's only in English. It doesn't have a Croatian
it's
version.
only in English?
Yeah.
Okay, great. So check out the book. I didn't read it, but I think it's pretty interesting.
Well, people say that, yeah, it's meant for non-technical people. It's
Okay.
meant for people who are wondering what blockchains are and how to use them. And I wrote the book basically at the start of the last cryptocurrency hype cycle. So it was 2017, and a lot of people started asking me, should they invest and what to invest in, and I basically said, no, you shouldn't, don't invest. And finally I wrote a book explaining why. So those who didn't listen to me lost a lot of money.
Okay, can you please unlock your phone so I can see the content that we need to go through? Sure.
Okay.
So let's go really quickly. What is blockchain? Really quickly. So like from a technical standpoint, but that the doctors can understand. Yeah.
Blockchain is a type of database. So
Sure.
as we have other types of databases, for example, relational databases. It's just technical detail, but blockchain is a shared database intended to be used to exchange data between multiple parties. And then come the other stuff. For example, those parties don't have to trust each other. They don't have to know each other as well as using a normal database for it. But for example, as you could use, as you can consider something like an Oracle database, so you could consider something like, I don't know, Hyperledger or even Ethereum or some other product. So blockchain is a type of database. It's intended for sharing data between multiple independent parties, and it does it pretty good as well as you stay within the constraints of the technology.
Okay, so when we have a great technology and we are thinking about how to apply it in a certain industry, we start often with a problem and then find a solution and an appropriate technology for that problem. In blockchain, regarding the blockchain part, because of the hype, people started with the technology, which is a common thing to do with the big thing, groundbreaking research, and in science also. In science, we always start with a solution and then try to figure out where we can apply this great new invention.
That's an interesting way of thinking. Yeah. Okay.
It really is, and blockchain goes into that box. So what is blockchain good at solving? So when can we use blockchain to solve which problems in IT and data security and things like that?
Basically, whenever you have to exchange authenticated data securely between multiple parties, and this data needs to be stored for a long time, and it needs to be stored securely and immutably. So now all of these buzzwords, all of these technical areas require some explanation. But the idea is that blockchains make sense to use for storing, let's say, sensitive data and exchanging this data between companies or organizations all over the world. So it doesn't make sense in storing generic data, which could be more easily and certainly less expensively stored in normal databases.
Okay, I get that part. So basically, when we look at existing systems in healthcare, for example, in Croatia, we have a pretty centralized and closed-off healthcare system. The IT and the electronic health record system is called CEZIH. It's a centralized electronic medical IT system of Republic of Croatia. That's a pretty bad translation, but yeah. And we also have hospital informatics system. Those systems are closed off and centralized. So when we need to exchange data in a system like that, we already have a trusted third party, which is CEZIH, that makes a settlement between all the hospitals and doctors and does the job for them. So in that scenario, we don't really need blockchain. But if we have a scenario where we cannot use a trusted third party, or we don't want to use it because they have their disadvantages, and those disadvantages are many. So in your opinion, from a technical standpoint, what are the disadvantages of centralized systems and not distributed ones? So they're hacker friendly.
Well, it's hard to actually pinpoint exact disadvantages of centralized systems. I mean, especially for something which is sensitive as medical data. I think maybe
lack of control by other stakeholders.
Well, it depends on what you mean by control, because data itself could be useful to multiple parties, but medical records are pretty sensitive, and you don't actually want to distribute them across a large number of systems. I'm not really sure.
Okay. So basically, what's being said is that centralized systems are sensitive to hacker attacks. Is that true in your opinion?
I have a background in IT security, so
Okay.
every kind of system is sensitive to hacker attack, including blockchains, especially private ones. So
Okay.
I wouldn't say that there's enough difference between those two to say that one is harder to hack than the other.
Okay. Okay. That's an interesting. That's actually a great thing to say, and I agree with that. So basically, so the thing that the question that arises is, where is your medical data? And if I ask you that, do you know?
By a very strange set of circumstances and coincidences, I actually do know. It is stored in exactly one place, and that is a drawer in my home. But this is because I am supposed to be transferring that from one medical office to the other, because I've moved, and I needed to change doctors. So I will get around to it, and I will actually transfer my medical data, which is like a small file of things about me. But for now, no medical institution anywhere has actually a copy of my medical data. So it is very strange. But usually most of people in Croatia keep their medical data at doctors, which is just doctors' offices, which is like a normal place to do it. As you said, there have been some IT systems created for this. As far as I know, it really, the bulk of medical data for most of the population isn't actually digitalized and isn't actually in those government-created systems. So it is being, let's say, dispersed all over the country in small and large doctor offices.
Okay, so when we're talking about data transfer, you as a patient right now needed to transfer your medical data to another doctor.
Yes, by hand.
By hand. So first of all, you needed to find out where is your data. That process was probably pretty hard. You needed to go to your doctor.
It is at the person's doctor. It
Yeah.
cannot be anywhere else.
Sure.
Yeah.
So you went to your doctor, and
Yeah.
what was the process like? You probably asked him, like, give me my data.
Yes.
Did he give you your data at that minute, or you needed to wait?
Yeah, I waited about half an hour until they found it in the large closets full of documentation.
So it was in paper format.
Yeah, completely in paper format.
So it was old data.
It is the most current data they have. Yeah.
Yeah. So your doctors are not using any electronic or digital records?
No, I don't think so. I'm not sure. But I don't think that I know any person who has their, I mean, in Croatia, right, which have their medical records digitalized and stored in some kind of a IT system.
Yeah. So I think that most of general practitioners actually are right now using digital medical records. And if you as a patient go to your doctor to get your data, the process is not that simple. It takes some time. And even if they have the data, you probably get it on a USB, on a CD-ROM or paper format.
Cool. That's not it. Yeah.
So yeah, I mean, that's not really practical because you have it in a hardware form.
Cool.
And you can lose it.
So is there a data format standard for medical data in Croatia? I don't know much about it. So is there something which says that those medical files, maybe, I don't know, attached images, documents, descriptions, proscriptions, are stored in a certain format, like, I don't know, JSON, XML, anything?
I'm not really sure about that, but I'm pretty sure that all the medical data is more or less formatted in a protocol that's defined.
Mm-hmm.
The problem is that you cannot really get it digitally. You cannot get it shared digitally.
Interesting.
And you as a patient cannot really get it shared through an app, for example. So if I want to see my data right now on my phone, I can't do that. And we don't really need blockchain for that because we can just use an app that will enable us to do that. But the problem that arises next is that when we get that data and then give it to another doctor, let's say in another country maybe, when he receives it, he needs to trust the patient that the data is correct, that it was
And,
not
yeah.
changed.
And they need to understand the data.
They need to understand the
Yeah.
data and to trust the provenance of the data, that the doctor really wrote that diagnosis and so on. And that's a problem. We can transfer data today with applications, using a cloud data storage and then just sharing the access. But when we do that, we can't really trust what we're seeing as doctors. And also insurance companies definitely can't trust anything that they get from their patients or insured population. So then blockchain comes into place. And blockchain can here provide some sort of data integrity. So can we go a little bit into that? Like how can
Yeah.
blockchain solve this problem of believing the data but
Yeah.
not using a trusted third party to give
Yeah.
the certificate?
One of the reasons blockchains were created were to store data securely and immutably, which means that basically the whole technical aspect of blockchains as an idea originally has this component of protecting data from change and also adding a layer of authentication of the data itself, so you know who created this data. In public blockchains, which are used maybe in Bitcoin, in Ethereum and such, the data which is being protected are financial transactions. So it's a pretty high requirement to have this data securely stored. By security, I mean resilient to outside change and also with provable authorship of the data. So by thinking in this way, we can create a blockchain system which would hold some perhaps fingerprints of medical records, and by fingerprints I mean digital fingerprints of digital data. So we don't want to store actual medical records in the blockchain because that would, among other things, probably be in violation of GDPR.
Sure.
But let's say we can store fingerprints of digital data in the blockchain, and since blockchains already protect all the data which is being written to them, we can make use of this fact to protect the fingerprints also. So we know who created this exact fingerprint. We can correlate this fingerprint with exact data which is being, for example, transferred in some other form to multiple parties, and we can be sure that this fingerprint is stored unchanged and, let's say, hack proof in quotes.
Okay. So exactly, that's the whole point of using blockchain, for example, in healthcare. Basically, it provides data integrity and actually kind of releases the data, because when you transfer it by using other methods, the data that is being transferred can still keep its integrity when it reaches the other hand. And for example, how will that system look like? Probably the medical data stored on some centralized cloud servers, maybe the patient's phone with a cloud backup, and all those data has their fingerprints stored on a blockchain, which is a layer on top of the medical data. And then when the patient arrives to the doctor receives the data, he creates the fingerprint of the received data and then compares the two hashes together, and if they match, the data was not changed. So that provides some kind of integrity. What about data interoperability, which enables better transfer between parties in the healthcare system? For example, we have 10 hospitals that are not connected and patients. Can blockchain solve this problem or not really?
Well, data interoperability is basically about all the parties or all the organizations in a system it can be a blockchain system, it can be something else, understanding and correctly interpreting the data. So if one hospital uses, I don't know, XML to exchange data and another hospital uses JSON, they really can't talk to each other without an expensive bridge software which translates data between the formats. Both hospitals can use, for example, XML and still have a different XML schema. So different tags, different names for certain parts of data. For example, one can have patient name and the other hospital can have just name, and that also requires a bridge between those two data formats. So,
there are certain standards and protocol that define how should you name certain things.
Excellent.
There are few of them, but they're not used by everyone most of the time, which is like the common problem when you're talking about standards in IT. But can blockchain solve this somehow, or is
not by itself?
Yeah,
so
sure.
Firstly, to exchange any kind of data between any two kinds of organizations, they need to settle down on the exact formats of data which is being exchanged. And then the second step is actually deciding on the mechanism of data exchange, which could be helped by a blockchain. It cannot be completely solved by a blockchain, not by a long shot, but some of the parts, like maybe distributed data integrity assurances, can be done by blockchain. So blockchain itself has no requirements or even no any kind of
features.
Yeah, feature specifications which pertain to data formats. So blockchains themselves have nothing to do with interoperability on this level. This gets even more complicated if different organizations use different blockchain software. Even the same thing with the XML example. So even if two hospitals use the same blockchain, for example, IBM's Hyperledger or any of the other ones, it's not nearly the best or the only product out there. They still need to agree what the actual data is. It doesn't. By saying that both hospitals use a blockchain, you're not really saying anything about the operability itself. You still need to define the data formats. You still need to define how the data is interpreted and all the other stuff.
Sure. So that's something that clears things out, because blockchain itself cannot solve directly the problem of interoperability, but indirectly it can help to solve that problem. And one of the ideas is the fact that in the healthcare system we have hospitals that are fixed and not moving. They have their own centralized databases at their own physical location. And the only guy that's moving, the only persona that's moving in this system is the actual patient. Okay. So the idea is to focus on the patient, to make him the owner of his data. So when he moves in the system, he just carries the data with him. And that can solve the interoperability problem, because if the patient has his data with him, there's no problem with interoperability, basically. He can just share it with the hospital.
No.
Okay.
It doesn't simply, there still needs to be an agreement or a standard in which format, firstly, this data is recorded at the patient's side. Okay. Secondly, patients or...
let's say that we have like the standard format, the most popular one, right?
We could say so, but I truly believe that it isn't true. So the other thing is that you really do not want end users to carry the only copy of their data anywhere, because
the idea is that it's not the only copy. So they have
if it's not the only copy, that it's fine. So if copies are distributed on hospitals, doctors, that it's fine. It's perfectly fine. But you really don't want to have the only copy in a cell phone which can be lost and damaged.
That's also important. So
if a patient comes, you can basically tell them to give you the data from their phone, which probably won't happen ever, or you can just request a data copy from the hospital or his general practitioner or something else. So, yeah.
Yeah. So the idea is that the patient has his data on his phone, encrypted, of course, but also on other locations that he can only give access to other doctors. Because the problem in data interoperability is not only the protocols and the standards, how we define the values in the databases, it's also the thing of who can see what and when. And blockchain comes into place here. Because if the patient is the one who's actually giving permissions to his data locations, to hospitals, then we solve almost the problem of interoperability with that. Okay, so we also have something that's pretty interesting in blockchain that was like introduced after Bitcoin. It's smart contracts that were introduced with Ethereum blockchain, and in healthcare they can actually help a lot, especially when we talk about insurance companies. So there's a thing called processing insurance claims. So we have a few scenarios, but I'll talk about two of them. One of them is when I, as a patient, travel abroad for like a heart transplant or something like that, and I'm insured in my home country, but my insurance covers some of the cost for medical tourism operations. Then I do my procedure in Turkey, for example, and come back to Great Britain with my data and the proof of what happened with me. The problem that arises then is that the insurance company needs to believe me that what they're saying is correct. Then they need to check if that doctor even exists, and then need to get the answer from the doctor along with the data from the doctor. So when we are claiming something from the insurance company, when we are processing a claim, the insurance company needs to get multiple data and multiple answers from everyone.
Yes.
And that takes a lot of time. It can take a month, maybe a week, not a week, it's a month, and maybe multiple months. And it takes a lot of time and money for the insurance companies and for everyone. Smart contracts are pretty interesting here. Do you have an idea? You wanna talk about that?
In this particular case?
Yeah. Okay, so if we have a smart contract, it can collect data from all the participants automatically?
No.
Okay, why not? Why not?
Because you will not ever store medical data or any kind of, let's say, agreements to use or any kind of permissions to use medical data alongside insurance data. So firstly, that will not ever happen because of privacy and data protection laws. So they will be in separate blockchains, which means that this data is not accessible by current technology or by current interpretation of what a smart contract is from a single smart contract. So this will not happen. So the best we can do in this case is to have different blockchains, one for insurance, one for medical data, maybe one for consent forms and other stuff. And for example, insurance companies can share one blockchain. In practice, it will probably be like 5 or 6.
We will need multiple blockchains for that solution.
For this particular purpose, yes, because different types of data have different data protection requirements, different security requirements, different privacy requirements. You cannot just bunch them up in the single database, meaning a single blockchain, right? So the best we can do is to have insurance blockchains, multiple ones, medical blockchains, and then when something happens which needs to collect data from multiple parties, this can be done digitally by querying different blockchains. But yes,
interesting.
This would speed up processing immensely, right?
Yeah.
It will not be done by paper. It will not be done by sending real paper.
It can be
posts.
done in seconds, right?
Yeah, like any digitalized IT system.
Yeah, because right now I know that doctors when they need to transfer some sort of like scans or things like that. If it's a patient that traveled from like a system that's not really connected that well, they send it by emails, and that's
If you're lucky.
yeah,
lucky,
sure.
yeah.
And email, I don't know if it's secure enough for that.
Probably not.
Yeah, probably not, and it takes a lot of time to see the email, to answer.
Yeah.
So yeah, blockchain comes into place here, but I'm pretty interested into this solution by having multiple blockchains. So for example, we could have one blockchain for doctor's identity and patient's identity, for example, right? And then a second one between insurance companies.
Yeah, very likely.
Can you like try to explain that a little bit, like?
Well, you asked about smart contracts.
Yeah.
So if we limit ourselves to, for example, insurance, the case of insurance blockchains, then smart contracts can do stuff like, firstly, what are smart contracts? Smart contracts are pieces of code, program code, recorded into the blockchain. So this is it, nothing else to them. And this program code can access the data within this blockchain if they are stored. So if once we get all the data for an insured party into the blockchain, then we can use a smart contract to decide what happens. Does the person get and what level of insurance claim is allowed for this person. They can maybe decide his eligibility for more insurance or other levels of insurance. So once we get all the data within a blockchain, then a smart contract can process this and decide something. This can speed up processing, and it can reduce costs by doing it all within program code and relying less on clerks and insurance workers doing it.
Or a trusted third party that's like processing all of that, but that doesn't exist right now. Okay, great. So if we have tokens on the blockchain, like a cryptocurrency, then we can go on the next level, right? We can also give patients reimbursement on the chain, on the smart contract automatically. So that will also improve the process, right? So, but that's pretty far off because of cryptocurrency adoption and things like that. So, but do you see potential there, or?
I think yes. So, if we can tokenize insurance payments and payouts are, I think, more important here. Then we could use blockchains as cryptocurrency carriers, and we can use smart contracts for deciding who gets what. So it is one of the things which is pretty exciting and which has pretty good potential. But it all depends on how exactly the data will be exchanged and stored between multiple parties, because the devil is in the details, right? So all of this is pretty much science fiction right now.
Yeah, in theory it sounds awesome, but when you start a project or start coding that, talking with hospitals and stakeholders, they're like, we'll see, and it takes a lot of time and work, sure. So the ultimate thing that blockchain can help in healthcare, in my opinion, are health data marketplaces.
Okay.
And that's like marketplaces enabled by blockchain are not only for health data but also all kinds of data. But in healthcare, it gets pretty interesting. So if we, for that, I think that we need to have a blockchain in place first, because it enables digital transfer of digital assets, and data is a digital asset. Without blockchain, we can't really trade digital assets without using some kind of like a trusted party or something to do the settlement. So basically, the idea is that you as a patient, if you get the control over your data, you could go and share it with researchers, with interested doctors that are specialized in certain fields that need more data to do research to improve their practice. And at the same time, you could get rewarded with tokens for sharing that data. So what are the obstacles here, and where's the real potential? What are we missing when talking about this?
Well, firstly, every participant in such system will need to agree on what exact blockchain product they are going to use. They need to settle database interchange formats, etc. So once all of this is solved, once there is actually a standard blockchain.
Can that be solved or not?
I'm skeptical. I don't think so, because there are really a lot of conflicting commercial interests being done there. So in theory, it would be great if, like the whole world or a part of the world, maybe the EU, used a single blockchain product and agree on, all the details like the data format, the data interpretation, usage, everything else. But unless this is mandated by a government or some intergovernment agreement like the EU, I don't think it will happen by itself. There just isn't. I think, at least, that just isn't enough commercial benefit in sharing and synchronizing data in the medical industry.
Okay, sure. So that's a fact, and it will be solved, I think. But we also have another thing that's interesting. It's DAOs, or decentralized autonomous organizations, and the use case for that in healthcare can be pretty interesting, but it's too disruptive in my opinion, because everything needs to be changed. And one of the ideas is that you could have an insurance DAO. So a DAO that's actually an insurance managed and governed by the patients and doctors. And that's a pretty interesting thing. Although everyone needs to use and adopt crypto first for that, and vote, and that's an obstacle.
So we can describe a DAO as a set of smart contracts which is used to basically create a virtual organization in which all participants, either end users or other organizations, perform basically every important decision or data exchange or interaction on the blockchain by using smart contracts. So if you have maybe a company, you can have a set of smart contracts which says, okay, how this company spends money, who does it employ, everything is on the blockchain, and which is more important, everything is decided by the blockchain, including, for example, salaries of employees. In the case of maybe healthcare industry or something, or some similar industry, the costs of certain maybe medical procedures could be decided not by individual hospitals, but by participation of all the stakeholders in the system, which is, as you said, pretty far away in what needs to be changed.
Yeah, so basically we can also tokenize the medical services. So you as a patient could have 10 tokens that represent 10 medical checkups, for example. And the thing is that right now healthcare is always, most of the time, in hospitals. It's centralized in systems like that. And by using a DAO or a blockchain, we could move towards patient-centered care and decentralize the healthcare system in such a way that we connect doctors with patients and not use hospitals as breeding grounds and like for disease and everything, but actually peer-to-peer healthcare, which is pretty interesting, and was a theory that was mentioned by Andrija Štampar back in the day. He's a pretty old legacy guy in healthcare, public health exactly, and he was talking about that the doctors should be going to the patient's home, and that the doctors shouldn't be in relationship with the doctors So the doctors should not be compensated by the patients. That was the idea. So that was the idea, and blockchain can help here to solve these problems by using a DAO and tokenized medical services and peer-to-peer interactions. So basically, we talked about a lot of things. Do you see a topic here that you think that we need to mention a little bit more to discuss?
Well, maybe I'd like to emphasize that the blockchain is like an idea. So, if you're saying we are creating a system based on a blockchain, it is almost like you're saying we are creating a system based on computers. So, yes, you are creating a system based on computers, but there's so much detail to be solved. There's so much things that can go wrong and which needs to be standardized first for the system to be usable. That just saying a blockchain means nothing. Which exact blockchain? Which exact product? How is the data stored? Which smart contracts are being used? How is it going to be adopted by the industry, and not by the industry? So industry is also general term. So by individual specific companies and by individual specific staff in those companies. So all those things needs to be solved before we can say that blockchain is usable in the medical industry or any other kind of industry. So cryptocurrencies are really the most trivial problem to solve by using a blockchain, because when you come down to it, it's only a number. So I have a number and I'm sending you a number, and this is it. Yeah. And in case of public cryptocurrencies like Bitcoin, Ethereum, and everything else, this number is visible to everyone. The blockchain is a public blockchain, and all the transactions in Bitcoin and Ethereum are visible to everybody. As soon as you get to storing
medical data,
any kind of private data, including medical
yeah,
data,
yeah,
you encounter a huge additional set of problems which were not originally solved by Bitcoin, Ethereum, or any other blockchain. So usually those kind of problems are solved by introducing other software which manages security on top of a blockchain. So this is something additional, and every time you have an additional system, it's one more system which can go wrong. So blockchain is too general a term to be used as a practical direction for anything. I think it's really it really needs to be narrowed down to specific implementations of everything. So any kind of discussion of using blockchains in any kind of industry remains vaporware, remains just a hype until it's broken down and agreed upon specifics for this particular implementation.
So when we're talking about this technology, we need to look at a case-by-case basis, not generally, because especially with this technology.
So if you go to a restaurant, you don't order a carbon-based food. You order a specific pizza or anything else. The same thing is here. Saying just a blockchain is simply too general to be useful. On the other hand, this kind of hype, this kind of marketing and PR which is being created around the blockchains can be used to drive a technology transition from old systems to a new one. So many countries, many countries including Croatia, have their medical systems which are created on really legacy technologies. So even our own system is a relatively new one. It's, I don't know, like 5 or 10 years old, something in this time span.
Yeah, it's not pretty new.
But it's not really old. I'd give it a top maybe 10 years.
Yeah, it is. I think that's correct,
but
actually. Yeah.
At the same time, it was created on technologies which were obsolete at the time of creation. So it was really a clusterfuck, because I know a couple of guys who worked on the project. So an idea like blockchain can be used to direct the hype and buzzword momentum behind it to create a new refresh cycle of older technologies. So if a hospital is considering replacing its IT system, we can use a blockchain as an excuse to make the new system better and more interoperable with other hospitals. So this is a good side of the hype and buzzword push behind the blockchain.
Okay, so that's a great way to end this episode, I think. Thank you very much, and we covered a lot of things. Didn't really go into too much detail, but I think that we cleared out some of the fog, the vapor, and
Hopefully,
that people that will be watching this in healthcare will finally understand what does blockchain mean, what can it do when you hear the word on conferences, because on every conference they mention that word.
Yeah.
And they don't really know what's behind it. So right now we kind of know, and that's the point. You can't really know if you don't look at the exact case. It has some potentials in certain fields, and that will be all be developed and seen in the near future and in the far future. How will things play out? So yeah, thanks, man.
Thanks.
Yeah.
Yeah.